Good morning. I am grateful and honored to be here and to have been asked to give a lightning talk for this Shifting Mindset Summit. My topic is living the protective factors, which to many of you doesn't really make any sense. It's like a secret handshake or an inside joke. What are the protective factors, and why is it important to live them? Well, when I talk about the protective factors, I'm speaking of a specific framework, the Strengthening Families Protective Factors Framework, that was developed by the Center for the Study of Social Policy in Washington, D.C., almost 15 years ago. The framework was initially intended for social workers and early childhood professionals. It offered a way to talk about the work they do with families and children. So these are the protective factors behind me, and their presence defines a healthy family. So a healthy family is one where the parents are resilient, they can bounce back in troubled times, they can come up with creative solutions to parenting challenges, perhaps viewing them as opportunities. Parents in strong families have positive social connections, a robust network of support, of people who have their back. And these parents can access help when they need it. They know about child development, and they have nonviolent parenting skills and strategies for dealing with their children's difficult behavior. They also promote the social and emotional competence of children, teaching and modeling for their children how to handle negative emotions and how to positively and effectively communicate with others. So basically, strong families are the ones in which parents and children have a strong bond of love and caring for each other. Initially, this framework advanced the well-meaning, open-hearted, compassionate, and respectful mindset that is central to family support. They were a huge contribution to the family support field because they explained in a simple way how to strengthen families, what people were doing when they were strengthening families. And they also showed child-serving professionals, early childhood practitioners, how they could and why they should shift their mindsets towards engaging parents as partners and strengthening families to benefit children. No one was talking about that 15 years ago, or at least not much. The point was not to focus just on the kids, and so over the past 15 years, these protective factors have been integrated into almost every funding stream for early childhood and child abuse prevention. And that's due to the excellent work of the Center for the Study of Social Policy and all the partners, the national partners. And I was the project director for Strengthening Families Illinois 7 years ago. And a funny thing happened to integrating the protective factors, on the way to integrating the protective factors into early childhood and child welfare in our state. And it happened because of a dad. Jeffrey Scott was on our leadership team for Strengthening Families because from the very beginning we believed in nothing about us without us. So Jeffrey was there and a lot of other parents were there, and we wanted parents at the table to assist us in figuring out what Strengthening Families Illinois should be. Jeffrey is an African-American father and a Head Start teacher. He began with the program as a parent leader on the Policy Council. And he stood up at one of the first leadership team meetings and he said, "I don't get you guys. You have important information that families need, and you're planning to get it to us by going through early childhood professionals and child welfare workers. Why don't you give it to us directly and don't dumb it down?" He issued a challenge, and this was the beginning of a complete shift in mindset for Strengthening Families Illinois and also for Strengthening Families movement nationally, because they hadn't considered parents as a primary audience before this either. It was the moment when Be Strong Families was conceived. What Jeffrey was saying was that this protective factors framework, this research-based, evidence-informed 5-item list could be used by ordinary people in their everyday lives to improve conditions in their homes and enhance their relationships with their children and other family members. To use an analogy, he was putting parents in the driver's seat and he was asking professionals to get out of the car. The proper place for them was at the driving school, when parents needed to learn how to drive the car, at the gas station when parents needed to fill up the car, the parking garage to leave their car somewhere safe, the car wash, the repair shop when the car needed routine maintenance or an oil change, and when, God forbid, the parents got into a wreck. There was a role. It just wasn't the primary agent of change role. What Jeffrey was asking early childhood teachers and family support professionals and child welfare caseworkers for was a completely different relationship. He was asking them to shift their mindset, especially with his request not to dumb it down. He was saying, knowledge is power, give us the power, don't hoard it, don't lord it over to us, don't make yourselves feel great by using this powerful framework to analyze us and then help us get where we're going. Respect us and give us the map. He was asking that we all recognize that parents are the leaders in their families. Parents protect their kids, even from themselves on their worst day. Parents prevent child abuse. Parents continue a legacy of trauma and adverse childhood experiences, or they disrupt it and reverse their family's trajectory. Parents build strong families. Parents can do this by living the protective factors in their families. Jeffrey was asking to shift the dominant paradigm of relationship between parents and providers by shifting the mindset of both parents and providers. He was encouraging service providers to view parents instead of themselves as primary agents of change. He was asking both parents and service providers to realize that every person and every parent, no matter how poor, how traumatized, how disadvantaged, how marginalized or excluded by others, has wisdom. What parents need is for there to be spaces, environments, opportunities where they can remember, explore, and reconnect with the wisdom, the creativity, the brilliance, and ultimately the divinity that is within every person. This is especially true for low-income people of color who have had more than their share of demeaning treatment and who have developed incredible resilience in order to survive. That resilience should not be taken for granted. It must be acknowledged and celebrated. It serves as the foundation for creating positive change. So Jeffrey's request resonated with me because I'm a white middle-class woman, and my relationship with service-providing professionals like doctors, therapists, employment counselors, parenting educators, coaches, has always had me in the driver's seat. I have been overwhelmed by a family situation at times. And I have suffered feelings of shame and guilt and incompetence as a person and as a parent. But I have never had to sacrifice my dignity or my agency in order to get help. For me, it's striking how people with money and people without money feel about accessing services. You just think about it for a minute. If you have money and you have a problem, you buy the expertise you need. And generally, you have choices and you feel respected in the process. You're the boss, and if you don't like how you're treated or you don't like how your child is being treated, you fire the provider and find a different one. If you don't have money and you need to access public services to get your family where you want it to be, then you often have to present yourself as needy, damaged, incompetent, and worse. Be Strong Families looks at the protective factors as an empowerment and action framework that gives parents skillful means to strengthen their families. We've worked with parents to develop innovative ways to do this. One example of this is parent cafes. We started parent cafes 2007, and you can get a taste of a parent cafe if you haven't experienced one later today at this conference. But deeper than this commitment, Be Strong Families was founded by a group of parents, including myself, who strongly believe that there's an important connection between social work and social justice. The best way I can describe this is through the work of, there's the parent cafes. And I talked to you about Paul Farmer, who many of you may know of. He's a doctor and a university professor at Harvard. He's the co-founder of an organization called Partners in Health, and he's worked as an infectious disease physician in Haiti, Peru, and Rwanda, and Boston. He wrote the book, In the Company of the Poor, Conversations with Father Gustavo Gutierrez. Gutierrez is the father of liberation theology. And Farmer's insight is the secular world needs liberation theology. So one central idea to liberation theology is that of structural violence. Violence is done to some people by poverty, racism, gender inequality, homophobia, and xenophobia. And this is structural violence, or as Gutierrez describes it, structural sin. It can be and is institutionalized, and it is insidious. An example, I read an article in the Washington Post a few days ago, May 21st, called "Kansas Has Found the Ultimate Way to Punish the Poor." Has anybody heard about this? Okay, so not trusting poor people to manage their money, Kansas just recently passed a law that will effectively restrict welfare recipients from withdrawing more than $20 a day from an ATM machine, forcing beneficiaries to make more frequent trips to the ATM to withdraw money from the debit cards used to pay their public assistance benefits. Since there's a fee for every withdrawal, this reduces their benefits, right? If a mom has to pay her rent and utility bills in cash because she can't afford a bank account, how many times would she need to go to the ATM to get that money? What if she doesn't live close to an ATM? Did the legislators talk to anyone receiving benefits to see how the policy would affect them before they voted for it? Were the consequences intended or unintended? An example of this in our world, teachers who have low expectations of children of color or poor children, creating activities and events for parents that we think they need without consulting them as to whether they want that or not. Generally, our world is oriented against violence and towards helping, and we're not consciously wanting or intending to reproduce inequality or racism. We want to help people, to uplift them, to assist them with rising from their difficult circumstances. Yet, according to the Kirwan Center for the Study of Race and Ethnicity at Ohio State University, many people, including well-meaning service providers, including us, have implicit biases. An example of this is the assumption that poor people, and especially people of color, must be taken care of because they cannot take care of themselves or their children, and that they do not have the intellectual capability, the will, or the capacity to improve their own lives or the lives of their children and communities. They need us. Liberating ourselves from implicit biases is tricky business because it means we need to really share power. Be Strong Families combats implicit bias and structural violence by allying with people within programs and systems, such as yourselves, who want to work to change implicit biases and promote equitable, effective approaches to community empowerment. Our primary strategy for becoming conscious and interrupting these biases, our own and others, is to ally with people who are going to be served to develop the services. We listen and we serve as a vehicle for getting their words out. One example of this is parent cafes. Another is our Get Real series. These resources that are going to be used by parents whose children have been removed by the state for abuse and neglect. We created these tools with parents who'd been through the experience and gotten their children back. So our trainers who provide workshops for birth parents and foster parents are or were birth parents or foster parents. In addition to silently, subtly dismantling structural violences, these practices also exemplify another core idea from liberation theology that Paul Farmer calls accompaniment. Paul Farmer says, and I'm quoting him here, "The power of this simple idea came to me in contemplating patients facing both poverty and chronic disease. They missed appointments, they didn't fill prescriptions, they didn't comply with our counsel, and this was true in every country in which I've worked. But when we began working with community health workers to take care to patients, the outcomes we all sought were much more likely to happen. Instead of asking, why don't patients comply with our treatments, we began to ask, how can we accompany our patients on the road to cure or wellness or a life with less suffering due to disease? So we all need to ask this type of question. How can we accompany our families on the road to a strong family? In sum, for parents, including us in this room who are parents, living the protective factors means understanding the power you have and that we all have as parents to create safe, secure, nurturing environments in our homes and to build strong families. We can't control a lot of what's going on outside, but we have a shot at controlling what goes on inside of our homes and of managing ourselves. Living the protective factors means knowing, as it says in the 2001 Surgeon General's report on youth violence, that risk factors aren't predictive due to the presence of protective factors. Living the protective factors means committing to using the protective factors as an action framework to increase the health and well-being of yourself, your children, and your families. For early childhood professionals, family support workers, social workers, doctors, psychologists, home visitors, child welfare caseworkers, parent advocates, teachers, whose livelihood comes from serving children and families, living the protective factors is also a matter of accompanying the parents of the children we care about on their journey, knowing they have what it takes to make the trip. Thank you.